Dangerous information reveals for the first time the deadly coronavirus. We all know that viral attacks are one of the most serious threats to humanity, and recently some countries, most notably China and parts of the Middle East, have been exposed to the coronavirus outbreak that has led to serious diseases and syndromes. But how did this virus originate and why did it spread? The coronavirus is in fact one of the most severe types of respiratory viruses and is the main cause of many serious diseases such as acute lung syndrome and Middle East syndrome that have emerged over the past few years. MERS-CoV infection is transmitted from humans through animals and then between humans themselves. Studies have shown that bats are the original habitat for the virus, and that it has been transmitted to mammals for a long time, and then to humans through direct and indirect interaction with HIV-carrying mammals. Some reports dating back to 2012 report that there are HIV-related infections in many countries in the Middle East, including Saudi Arabia, Qatar, Bahrain and the United Arab Emirates, and more than 80% of these infections are reported in Saudi Arabia, and show that more than 80% of these infections were in Saudi Arabia. Research suggests that the infection was the result of the direct interaction of citizens in those areas with infected camels and meat intake, as well as interaction with previously infected patients. Causes of coronavirus. As mentioned earlier, the source of the virus is camels, so dealing directly with camels and eating one of their products, milk or undercooked meat, carries a high risk of human transmission. There have also been reports of human-to-human transmission, particularly among healthcare center workers. The risk of HIV transmission is increased in patients with some of these chronic conditions, chronic diseases such as diabetes, chronic pneumonia and heart disorders, young and elderly patients. Member transfers. In these cases, patients are subjected to immunosuppressive drugs to ensure that the body does not reject the new implanted organ. Unfortunately, the death rate from MERS-CoV is high, with some statistics indicating that it has reached 35% of the infected symptoms of Crohn's disease. Corona is classified as a flu-like disease, with signs of pneumonia, and more precisely its symptoms are similar to acute pneumonia. Here are some of the main symptoms of the disease. Fever, constant cough, shortness of breath, chills, chest pain, throat inflammation, headache, diarrhea,